Dr. Taggart, during our previous conversations, you've referred to autism as specifically not a fixed or immovable object. When you use that phrase to explain a diagnosis to a caregiver or family member or another clinician, why do you specifically use that phrase and what message are you trying to convey?
I love it when I get asked this question, Adam, because it's such a good news topic in autism. So, autism is not a fixed, immovable object because there's so much that we can do about it now. Um, our discussion earlier about the treatment team around autistic kids that we can build, that treatment team can be so helpful, especially if there is early intervention. And there's so much we can do to move autism and its struggles and impairments that bother the bother and concern the child with autism, their parents, and take those concerns, those struggles, and move them to a much reliably better place, especially with early intervention. And all of these at this point in the year 2024, very well researched, very reliably effective interventions that we have for the social aspects of autism, the communicative and language aspects of autism, the rigidities that we see in autism, the sensitivities that we see in autism, those areas that can be so uncomfortable, so much full of struggle and concern for families with an autistic child. Those are so not rocks that we can't move. They are areas that we can very reliably progress in towards betterness. And so it's an area where I can deliver, I and my colleagues can deliver lots of hope for families, eh, helping them know that this is something we can move in the right direction. Some kids with autism, if the intervention is early enough and the intervention works well enough, it always really reliably works to some degree. But if it works well enough, then we can sometimes make kids' autism a lot less detectable, even to professionals years down the road. And so that's another yardstick that I like to apply when we can, and it's not uncommon that we can apply that yardstick to see how far a kid with autism has progressed. So I love that you asked this, Adam. I want to emphasize that early intervention is so helpful in moving things in the right direction as much as they possibly can, because kids' brains are so plastic. And what I mean by that is that they can form new neural connections, new wiring, if you will, very reliably and much more than adults can. There is plasticity in adults' brains. We're discovering that in recent years, that even well into adulthood, we have the ability to form new wiring to affect our own wiring in the right direction, to move it in a better direction in many ways. However, with kids, that ability to affect the wiring in positive directions is even more vigorous. We have more ability to mold. And so, again, early intervention with this treatment team that we've talked about, with the various professionals who can help so much in these various areas, as I mentioned, from communication and social and rigidities, the whole constellation of autism symptoms can be moved at least somewhat in the right direction, and not uncommonly a lot in the right direction. So there's plenty of reason to hope here.